الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته.
His Excellency Dr. Jama' Farah Hassan, Minister of Health of the State of Puntland and the Government of Somalia, representatives from the federal member states and federal government of Somalia, representatives from WHO, AFNID, Swedish Public Health Agency, the Swedish Development Agency, and all other development partners here. SHAJ, Somali Health Action Journal, researchers, partners, esteemed guests, ladies and gentlemen, a very good morning to all of you. It is of immense pride and honor for me to inaugurate this historic public health research conference, which is the first of its kind to be held by the National Institute of Health and the Federal Ministry of Health. This conference, whose theme is laying the foundation for Somali's public health research, will provide a platform to students, universities, researchers, and many others to showcase their research capacity, share knowledge and expertise in different aspects of the public health, and finally reflect on and find an evidence-based and context-specific solutions that can address the health system's challenges Somalia is facing. Ladies and gentlemen, since the National Health Institute was established in last years, it has made great strides towards reaching its goal or aim of ensuring a healthier future for Somalis through evidence-based research. This is our long-term goal. We know it is a journey which requires unwavering political commitment and financial support from the government, the private sector, the academia, and all our stakeholders. It's therefore incumbent upon us to be at the forefront of improving the healthcare system in the country. This public health research conference provides a platform on which to build upon research that could play a huge role in improving the health outcome of our people. During these coming 3 days, researchers from various institutes and universities will take center stage to present on multidisciplinary topics in an effort to spearhead and encourage research culture in the country. I applaud each and every one of you for breaking new grounds as you serve the Somali people. Congratulations. The National Institute of Health and its board of directors, its scientific committee have played a leading role in motivating so many young men and women to publish their findings and abstracts on key health topics that will make a difference to lives of our people. Congratulations again to you as well. In recent months and years, we have made tangible progress towards health systems recovery in Somalia through efforts that are consistent with our policies, strategies, and actions aimed at attaining universal health coverage by 2030 and rebuilding the different pillars of the health systems. For our part, we have closely collaborated with national and international partners to bring to life many initiatives whose impact will be felt for a long time to come. I encourage you to document these national efforts, both what works and what does not work and why, but above all, provide us solutions that can address to the challenges we will face. A few such examples include the implementation of the essential package of health services, particularly by the hard-to-reach areas, the establishment of an integrated disease surveillance system, the actualization of frontline field epidemiology training, our response of COVID-19 pandemic, and many others. Lastly, ladies and gentlemen, allow me to remind you that your presence in this conference is very important, rather than we hope that whatever lessons you take away in this next few days here will inspire us to play an active role in the promotion of health research and build a network among health professionals and scholars, regional organizations and international collaborating centers in identifying research needs and priorities for the country. I urge all universities to allocate resources for research capacity building purposes for our young generation. Finally, I would like to register my gratitude to the Ministry of Health of Puntland State for hosting this historic conference. I would also like to thank the NIH team and our health partners, including the government of Sweden, the WHO, AFINET, Sharjah, for their efforts in making this conference a reality. And last, all researchers and their institutions for their participation. Thank you for your efforts and attendance.